Hey, it's Dr. David, the ENT doctor. I'm going to talk today about reflux as it relates to obstructive sleep apnea in adults. Reflux describes a situation where a stomach acid is coming up from the stomach, up through the esophagus, and the specific type of reflux I'm going to talk about today is reflux that actually gets up into the throat area. Now, when that happens, that causes a whole range of things that can contribute to obstructive sleep apnea. First of all, it causes irritation in the throat at the back of the tongue. And on the back of the tongue, there are some tongue tonsils, and these can swell up and start to block the airway. The next thing it can do is it can get up into the back of the mouth and affect the back of the mouth tonsils and make them swell up. It can get into the back of the nose, and usually in adults the adenoids have gone, but one of the reasons that adenoids will hang around into adulthood is because of reflux. So the reflux can make the adenoids, which should have disappeared, grow and cause blockage. The other thing that reflux can do is it can get right into the nose and irritate the nose and cause the nose to swell and congest up. And basically, if you think about it, that's a blockage at every single level. Front of the nose, back of the throat, back of the tongue. Now, when people get this reflux, they may not necessarily get heartburn and indigestion. It's what we call silent reflux. And sometimes they'll have other symptoms. So, for example, a cough, phlegm in the throat, a croaky voice, or a nasal drip would be common things. Some people even get sort of pressure and feeling of blockage in their ears. So when people come and see us as ear, nose and throat doctors because of their obstructive sleep apnea and we're putting our telescope down, one of the things we're doing when we look down is we're looking inside the throat, we're looking for reflux changes. Because if there are reflux changes, then treating the reflux helps settle down the irritation, which helps settle down the swelling, which then opens up the airway, which of course is the progress that we want in terms of people being able to breathe and sleep better. So that's it in a nutshell, but there's one more catch to it all. So as I've explained, when you have reflux, you're more likely to get the sleep apnea. The problem is when you get sleep apnea, you're also more likely to get the reflux. So it's a vicious circle. And a lot of people, because it's silent reflux, they actually get it when they're asleep and they don't realize it. So seeing an ear, nose and throat doctor that can have a look is really helpful. Now, some people will have an endoscopy looking down into the stomach and be told their esophagus is absolutely fine. And that's quite often the case because it's just a little bit of acid getting all the way up that causes irritation. That little bit of acid is not enough to change the way the esophagus looks. So there you go, a little bit about silent reflux and obstructive sleep apnea. Cheers.